This is a presentation on how to use project management techniques for the implementation of an electronic health record. The purpose of using project management is to make sure that the project process is time-sensitive and that the project plan is comprehensive as to include all necessary tasks. This will allow for a smooth project execution. Further, the purpose of the product of the project, the electronic health record, or EHR, is to improve the quality of care in the healthcare setting. The EHR is intended to reduce medical errors and improve patient satisfaction. As will be described in detail momentarily, the total length of the project of implementing the EHR is 238 days. Here is a list of all of the major tasks involved in implementing the EHR. The first row shows the total time for the entire project, which is 238 days. The next 7 rows list the 7 major tasks for the project along with their start and finish dates. Circled in green, imaging and nutrition and food services are the major tasks that take the fewest days to implement at 11 days. And in red, the clinical information system takes the most days at 119. The final column of the row entitled Predecessors indicates what needs to be complete before that task can begin. Also, as you can see with the start and finish dates for each major task, patient information management is the first task to begin and clinical information management is the last task to begin. Before we go into detail about the subtasks, a few assumptions about the data should be discussed. Within the subtasks, different parts of the subtasks must be completed before others are started. Also, many of the subtasks include both configuration and training. For this case, it has been assumed that configuration must be completed before training starts. It has also been assumed that trainings within a major task can overlap. Here is a list of the subtasks within the major task of patient information management. Boxed in green, Enterprise Master Patient Index, number 9, is the first subtask that must be completed. In yellow, the next task that can be started is number 7, Configuration of Patient Registration. Since number 7 requires number 9 to be completed before it starts, the number 9 is listed in the predecessors column for number 7. The same configuration scheme is used throughout the rest of the major tasks and subtasks to determine the task breakdowns and the total project length. The project management software also provides a visual representation of the project timeline in a Gantt chart. As an example, here's the accompanying Gantt chart for the subtasks of patient information management. As just shown with patient information management, the same configuration scheme is used throughout the rest of the major tasks and subtasks to determine the task breakdowns and the total project length. Here are the subtasks for clinical information system. Shown here are the subtasks for the laboratory. This split screen shows both the data chart with start and finish times as well as a visual Gantt. Next shown are the subtasks for pharmacy. Expanded here are subtasks for radiology. Similarly, here are the subtasks for imaging. And finally, here are the subtasks for nutrition and food services. Overall, by indicating the prerequisites of each major task and subtask, the project management software was able to determine the start and finish times for each subtask, task, and the total project. Using a tool such as Microsoft Project has several advantages. Project management software is helpful for complex scheduling as the program can work with dependencies and reveal start-finish times based on the relationships of the tasks. Also, project management tools can create various visual ways of displaying the project schedule and requirements, such as through the Gantt chart. This can help project managers and team members stay on track. Finally, using this type of project management creates an easy way to share project schedules and expectations with team members, which can improve planning and completion of projects. I hope this presentation helped explain how project management can help in the implementation of an electronic health record.